Hypnotherapy, often misunderstood and misrepresented in popular culture, is a therapeutic technique that utilizes hypnosis to facilitate positive change in a patient's thoughts, feelings, and behaviors. Its mechanism of action is rooted in a complex interplay of neurobiology and neurochemistry, which can significantly enhance patient care when integrated with modern medicine. Understanding how hypnotherapy works at a biological level provides insight into its potential applications in treating various diseases and conditions. At its core, hypnotherapy involves inducing a trance-like state of focused attention and heightened suggestibility. This state is characterized by a unique brainwave pattern, often shifting from the typical beta waves associated with alertness to alpha and theta waves, which are associated with relaxation and deep concentration. Research using neuroimaging techniques such as functional magnetic resonance imaging, fMRI, has shown that during hypnosis, certain areas of the brain become more active while others are less engaged. For instance, the anterior cingulate cortex, which is involved in attention and emotion regulation, often shows increased activity, suggesting that hypnotherapy can enhance a patient's ability to focus on specific thoughts or sensations while diminishing the influence of distractions. Neurochemically, hypnosis appears to modulate the release of neurotransmitters and hormones that affect mood, pain perception, and stress response. Studies have indicated that hypnosis can lead to increased levels of endorphins, the body's natural pain relievers, as well as alterations in the levels of cortisol, a hormone associated with stress. By lowering cortisol levels, hypnotherapy may help mitigate the physiological effects of stress, which is known to exacerbate various health conditions, including cardiovascular disease, gastrointestinal disorders, and chronic pain syndromes. The integration of hypnotherapy into modern medicine offers a promising avenue for enhancing patient care. One of the most compelling applications is in pain management. Chronic pain conditions, such as fibromyalgia, arthritis, and migraines, often resist conventional treatments. Hypnotherapy has been shown to reduce pain perception significantly, with some studies reporting up to a 50% reduction in pain levels. This is particularly beneficial for patients who seek alternatives to pharmacological interventions, which can carry risks of dependency and side effects. By utilizing hypnotherapy, healthcare providers can offer a holistic approach that addresses both the physical and psychological aspects of pain. Anxiety and stress-related disorders also stand to benefit from hypnotherapy. Conditions such as generalized anxiety disorder, post-traumatic stress disorder, PTSD, and phobias often involve maladaptive thought patterns and heightened states of arousal. Hypnotherapy can help patients access their subconscious mind, allowing them to confront and reframe these patterns. The relaxation techniques employed during hypnosis can reduce anxiety levels and promote a sense of calm, making it easier for patients to engage in therapeutic practices and cope with their symptoms. For instance, patients undergoing surgery or invasive procedures often experience significant anxiety. Studies have demonstrated that patients who receive hypnotherapy before such procedures report lower anxiety levels, require less sedation, and experience faster recovery times. Moreover, hypnotherapy has shown promise in managing psychosomatic disorders, where psychological factors manifest as physical symptoms. Conditions like irritable bowel syndrome, IBS, and certain types of skin disorders have been effectively treated with hypnotherapy. By addressing the underlying psychological components, hypnotherapy can lead to significant improvements in symptoms and overall quality of life. This is particularly relevant in a medical landscape, increasingly recognizing the mind-body connection and the importance of addressing psychological well-being and physical health. Additionally, hypnotherapy can play a crucial role in behavioral modification, particularly in the context of addiction and habit change. Smoking cessation programs that incorporate hypnotherapy have reported higher success rates compared to traditional methods. The suggestive nature of hypnosis can help individuals visualize themselves as non-smokers, reinforcing their commitment to quitting. Similarly, hypnotherapy can assist in weight management by addressing emotional eating patterns and fostering a healthier relationship with food. The effectiveness of hypnotherapy is further supported by the concept of neuroplasticity, the brain's ability to reorganize itself by forming new neural connections throughout life. Hypnotherapy can facilitate neuroplastic changes by helping patients develop healthier thought patterns and coping mechanisms. This is particularly relevant for individuals recovering from trauma or dealing with chronic mental health issues, as it empowers them to reshape their cognitive and emotional responses. Despite its potential, the integration of hypnotherapy into mainstream medical practice requires careful consideration. Training and certification for practitioners are essential to ensure that hypnotherapy is conducted safely and effectively. Moreover, ongoing research is necessary to further elucidate the specific neurobiological and neurochemical mechanisms at play, as well as to establish standardized protocols for various conditions. Hypnotherapy represents a valuable adjunct to modern medicine, offering a multifaceted approach to patient care that encompasses both neurobiological and psychological dimensions. Its mechanisms of action, rooted in altered brain activity and neurochemical changes, highlight its potential in treating a range of conditions, from chronic pain and anxiety to psychosomatic disorders and addiction. As the medical community continues to embrace holistic and integrative approaches, hypnotherapy stands poised to enhance treatment outcomes and improve the overall quality of life for patients across diverse healthcare settings. By bridging the gap between mind and body, hypnotherapy not only empowers patients, but also enriches the practice of medicine itself, paving the way for a more comprehensive understanding of health and healing.